Hello. So we have basically finished our course on Peyronie disease. So as you can understand, it's a health awareness course. Okay, it's a health awareness course for all male individuals who have this sexual problem. So, and as I said, the purpose of me discussing all these issues as in a course form which has hitherto had never been happened is to make you understand that this is a problem that we all may suffer, and we have to understand that we are suffering this problem because when we believe that we are actually suffering from the time has gone, but basically we are in the complication stage. So it's from primary it becomes a secondary. So as a prevention it doesn't, it becomes we have to go for a treatment. Okay, so that's what I wanted to say. So in short what we discussed is that Peyronie disease is a very debilitating disorder, and where the penis is actually bending, and the slow bending, and because there is a small amount of injuries being happening to the penile shaft. Okay, what is the penile shaft? With the body of the penis. Okay, and all this being erection things are happening because there are some cylinders over here. Okay, cylinders, they're known as a corpora. They're basically two cylinders which are nothing but two sponges. And whenever you put a sponge in a bucket of water, it becomes swollen up. Same thing happens when we are excited. The brain stimulates some neural signals, and there's a pumping of the blood into the sponges, and the sponges get inflated with blood. And whenever it happens, suppose the sponges get inflated with blood, they're basically expanding. And when they're expanding, they're basically expanding the layer, the layer which actually protects these structures. Okay, and this is known as the tunic albuginea. It also expands because it is a elastic tissue, like it's a rubber band like thing. It expands up to a certain level. It doesn't break actually, up to a certain level. So after that, the rigidity happens. Now it doesn't expand, so it's the girth is increased. Now the rigidity happens, so the penis become more rigid. But when there is accumulation of this fibrosis, abnormal collagen tissue, the normal collagen tissue doesn't is all replaced by abnormal collagen tissue. Then what really happens, it doesn't expand well, and also there's leakage of blood. So ultimately the patient will have erectile dysfunction, and patient will not have an erection at all. And all these things, when these heart things, there will be nerves, blood vessels, arteries, veins, and nerves are also in their penis. These will incorporate with the nerves and will cause severe pain in the early part. So all this thing happen, patient will have pain during intercourse, patient will have this curvature of the penis, abnormal curvature of the penis, this erectile dysfunction, and ultimately these patients will suffer in silence. And also there's a lot of frustration of the patient himself, and also with his partner. So the patient ultimately loses all interest in sex, loses all interest in life, because he's so frustrated. So if as what I wanted to say, if in the initial part, if we knew that he's having this, he's being forced or whatever, he's have to do this sex with his partner in a soft penis, that is not able to have proper erections, and if we could have given him medicines, if we could have taken medicines to improve his erections, whatever the medicine, maybe it could have been due to his decreased libido, because decreased testosterone levels, and he could have taken supplements for that, increase in testosterone levels to be at the peak of his health and peak of his sexual health, and then perform. Or it may be due to some other problem, that his erections, nocturnal erections are normal, something is happening with his some emotional issues with his partner, that also can be solved. And the erection problem must be sorted out, so he doesn't have sex with a soft penis, with a non-erect penis. That is the most important thing. That's the most important thing. I tell you, my dear friends, have the erection issue sorted out before you have your sex. Don't force yourself to sex, or else this problem is very common, my dear friends, very common. Previously people didn't come to us, then that's why they were all underreported. You didn't hear, you would have heard about erectile dysfunction but never heard of this problem of Peyronie's disease. But now the scenario is changing because there's a lot of people are coming to us. They're more open, they go to the internet, they see this, okay, this is happening. Another group of people feel that there's a nodule, or there's a tumor like substance I can feel on my penis, and that's a very private organ of feel. It can be a cancer, then it comes. Okay, and the cancer never has pain. There's a Peyronie disease which causes pain and erectile dysfunction. Okay, that is the very important thing we need to point out. Also, if there's happening, if there's a small amount of, you have noted that there's a small amount of this thing hardening, a soft thing, it's happening, it's abnormal, just put some ice packs. So it breaks up the collagen tissue being forming, fibrosis tissue breaks up the fibrous tissue being formed. Okay, because they are basically blood vessels which are leaking, forming a small hematoma. What will happen? In small hematoma, you put an ice pack, same thing happens. You put an ice pack for some time, then this hematoma will dissolve, and that does not cause the fibrosis in the long term. These are small home remedies you can undertake. There's a relation with vitamin E supplements, but again, you can take them, but in the very early stage. Only then it helps. And when the fibrosis become to some extent that this become irreversible, then cutting these things and doing all these surgeries doesn't really help. It's very debilitating surgeries, and not much good response are there. Okay, so that's it, my dear friends. That is for this course. I hope it has I'm able to put my point across on this very dreadful disease. Okay, you can call it a disease, you can call it an entity, but it is causing a lot of problems in our house also these days. So be aware of this and stay fit and be healthy, and we will coming with another new fresh new course. Till then, bye bye.